94.1 WHRP, Tony in the morning and DJ Primetime 256. It is Wellness Wednesday. We are wrapping up the month of October.
Yes.
Oh my goodness. And here we are closer to halfway through the year. And so many people are dealing with a lot of different situations when it comes to health. And that's why we are talking to Dr. Whitney West for Wellness Wednesday. Good morning, Dr. West.
Good morning, Dr. West.
Good morning, all. How are you?
Doing great. Well, we wanted to tap into the importance of taking medicine as directed. Your doctor tells you to take the pills, and also on your prescribed medication, it tells you when and how many times you should take the pills or medicines. And if you don't do it as directed, well, maybe that could cause harm. How important is it, doctor, to take your medication as directed?
It's really important to take it as directed. I'm going to give you an example. Antibiotics. There's a reason why we give you 7 days or 10 days or 14 days to take an antibiotic, because it takes that long for the body to clear the whatever the infection is. So if you only take half of it, or you took one every other, and it takes you longer, then the effectiveness is going to be decreased significantly.
Yeah, because there's a lot of people that will take medicine such as an antibiotic and say after 2 days of taking the medication, oh, I'm better, I feel all right.
Great.
Yeah.
Right, but it'll come back.
And you're supposed to feel good, right? But you're supposed to try to get rid of whatever the ailment is by taking it all the way through the prescribed direction of taking that medication. All right.
Correct.
So what about when we are taking what we feel is making us feel better, vitamins with the medications that have been prescribed?
So it's actually really important. Just because they say they're natural doesn't mean they cannot cause you harm, especially if they are mixed with certain types of pharmaceuticals, like medications that you prescribe. There are some that will have called interactions. So it is important that when you are in the doctor's office and you're discussing what medications you're on, that you also include vitamins and supplements, because they can actually work against each other if you're taking them at the same time, or have what we call a synergistic effect. They can work together, and you're having double of the effect that you're supposed to have, because you're taking a supplement that does the same thing as the medication.
We're talking to Dr. Whitney West about the importance of taking medicine as directed. Dr. West, now, taking your medicine as directed, not other people's medicine. Oftentimes we have a family member or a friend that has the extra pain medicine or something that we may need for that headache. How important is it not to take their medicine because it's not yours?
Well, that's extremely important. There's opioid addiction is out there. So people are sharing stuff. Now, pain medicine is probably one of the only medications that you probably don't need to finish. You don't take it if you don't need it. So people may have some extras left over. But it's really, really important to be mindful that isn't yours. And depending on what it is, you may or may not have a reaction to it. Different manufacturers put different inactive ingredients in their medication. So there are some that you may be allergic to, like the color, like the dye or something in there, versus the white pill that doesn't have anything in it that you're used to taking. So you got to be careful with all of that.
Yeah, and so even the potency of this medication, one person could have a little bit higher than the other, even though it says it's the same thing. It may not be exactly the same. And if it's been prescribed to you personally, it's from your doctor visit. Is that correct?
That's correct. There are some pills that have combo, so there's multiple things packed in one pill. And that may not be what you need. And if you're taking something else that may interact with that other ingredient, that could be a bad outcome.
So basically what I've learned is if you're taking other people's pain medication, you don't need to be doing that. If you're on pain medication and you're feeling better, you can actually stop taking the pain medication. And then the other one was if you had an antibiotic, you want to finish it all so you do heal and get better.
And let your doctor know everything that you're taking so they can prescribe you the right things. So there's no side effects or adverse reactions.
That's correct. That is absolutely correct. So sometimes we don't ask. We don't ask as physicians all of the right questions, and patients feel uncomfortable offering that information as well. So we both got to work together to make sure we're getting all the information out there on the table so we can do what's best for the patient.
I'll be honest with you, doctor. When you have a doctor visit, it feels like you're in the principal's office. You don't want to tell on yourself. You don't want to get in trouble with your doctor. So that's why a lot of times we withhold information. But it would be helpful if doctors would ask certain questions to get the information out of us as a patient. I'm just saying.
Yes, I feel you on that. I try to do that, and I tell them there's no judgment in my office. There's no judgment. I ask questions because I need to know the information so that I can better take care of you.
We're talking to Dr. Whitney West, MD, PC, gynecologist in Madison, Alabama. What's the best way to get in contact with you?
My website is www.westmdpc.com.
And your parting words?
Empower Wellness. It's a journey, not a destination.